Coming of Age is coming up next. I'm your host, Emily Echeverria. First today, we're talking about Baptist's unique Faith Health Network and how this integration of healthcare and faith-based organizations promotes better community health. Next up, we're discussing the City of Pensacola's 10-year strategic planning process and how you can share your vision for the city. Finally, we're talking with United Way of West Florida Director Laura Gilliam about the organization's current initiatives and centennial celebration. Stay with us. Coming of Age starts right now. As we age, staying active in life and involved in the community can become a challenge. But with Council on Aging of West Florida's wide range of home-based services, you remain healthy, independent, and engaged. From Meals on Wheels and respite care to senior dining sites and the retreat, you'll find the support and connection that you need to age well. Aging looks different for everyone, and we're here to help you meet your needs and thrive while maintaining what makes you, you. We've been in the community since 1972, advocating for elders and supporting those who care for our parents and grandparents. Now, join us as we discuss the age-related issues that matter to you. Joy Powell, the Director of Community Health for Baptist Healthcare, is here today to tell us about Faith Health Network, a program offered by Baptist that combines the many resources of the healthcare community with the strength of local congregations to promote the delivery of high-quality healthcare. Thank you for being here today, Joy.
Thank you for having me.
Can you provide an overview of the Faith Health Network and its primary goals?
So the Faith Health Network is a partnership between Baptist Healthcare, our only local and locally governed healthcare system in our region, and the local faith communities. Okay, so what it does is there's an intersection between where faith and health connect. So what we do is we make sure that the members of congregations are healthier, right? So that they can attend church more regularly and that they can have a better quality of life. So how we do that, we leverage trust and resources to ensure that individuals can really be helped throughout their life's journey.
Absolutely. I think that the community provided by these congregations is such an important part of health. So to be connecting with that is the perfect idea, I think. So how does the network address health disparities and improve access to care for underserved populations?
So when we talk about disparities, the first thing that we have to understand is that disparities are preventable. And so what we do is we look at the data from our community health needs assessment, which just closed for our two counties, which is Escambia and Santa Rosa. And we decide with the pastors and congregation members what we're going to focus on. So for instance, when we're talking about hypertension, right, disparities are really controlled by what we call social drivers or social determinants of health. Mm-hmm. So if you have an individual that has high blood pressure, we want to make sure that they have a regular PCP, a primary care physician, that they are taking their medicines. In order to take the medicines, you have to be able to afford the medicines. And eating well, having a balanced, proper diet. So we use different social drivers of health to help curb disparities. And so that's what we do for disparities in our two-county area.
Gotcha. So what challenges has the Faith Health Network faced, and how have you addressed them?
So one of our biggest challenges is the mistrust of the healthcare system. Healthcare is very fragmented, it's segmented, and it's scary for some. And so what we try to do is do three things. We make the connection, we listen to understand the needs of the residents, and we honor our commitments. So we believe in leveraging trust to help to alleviate the mistrust of the healthcare system.
Absolutely, and that trust is so important to have.
It is.
So how does the network measure the effectiveness of its programs and services?
So data, right? Data, everybody wants data, but you have to have data that is impactful. So we use better off measures. So our community is better off because of certain things. It's better off because of our Food is Medicine program. It's better off because of our church-to-church food pantry program. It's better off because of our Legacy campus and senior outreach around the Fricker and the Legacy Baptist campus. So we use the stories of the people that we touch. We look at things like, of course, has your blood pressure gotten better? Has your health improved? but we always want to understand how we make people feel. And so when we marry those two things together, it's basically a return on impact. And that's what we do for success. That's how we measure success.
So it's kind of a mixture of those quantitative data, that those actual numbers that came out of the vital signs, and then also that qualitative data of someone's experience.
Yes, and so when we marry quantity and qualitative, it's better off measures, yes.
Awesome. So what are future plans or goals that the Faith Health Network has?
Our future plans are to expand. We just signed our first congregation in Santa Rosa County that is on the peninsula, so woohoo. And so we are really trying to get more churches involved. And it's a process, but it's a worthy process. And so we're really looking to go into some of the chronic diseases like diabetes prevention, not so much as management, but how do we prevent diabetes, the onset, with like proper exercise and diet. So that's where we are for the future tense, and just to continue to help make Escambia healthier.
And how can individuals or organizations get involved with or support the Faith Health Network?
So we have the easiest number in Pensacola. Baptist does have a new area code, so it's 448-227-PRAY. So it's 448-227-7729. That is our main number. You can always visit our website, ebaptisthealthcare.org/Faith Health Network, and that's how you can find more information.
So can you tell me about some of the specific programs and initiatives that have been most successful? You've mentioned a few of them.
Yes. So we know here, and I know you're going to have United Way behind me, food insecurity is a big thing. So to watch our community rally around the need for food, we have two initiatives that we partner with other organizations on, because we believe no man is an island. And so when we find people that are doing things really, really well, we just like to, kind of help embrace those things and get it into the community. So one of them is the Food and is Medicine program, and it's a combination of organizations like Levin, Papatoni Rafferty, American Heart Association, Manna Food Pantry, all of our healthcare providers here locally. And we deliver fresh produce to the seniors at Wesley Scott every other Wednesday to make sure that the senior food insecurity is low. We've gotten so many stories from that. One young lady, we knocked on her door. She said, "I'm glad you're here because I didn't know how we were going to eat this week." Wow. So it's really, and we're also monitoring their blood pressure, their diabetes numbers, and their cholesterol to see if it gets better, because they are not being introduced to that. We have another one called Church to Church Food Pantry, which is out of First United Methodist downtown, and we have congregations come in to get groves of food and take it back to other communities. For one, we have one church that goes all the way up to Molino.
Wow.
So yeah.
And it's so important to get out to the kind of farther reaches of the counties.
Yes, it is.
Well, thank you so much for sharing this with us.
Thank you.
Glad to have you here. Next up, we're discussing the future of Pensacola and how you can get involved. Stay tuned.
The Reesburg Institute, Pensacola's ear, nose, throat, and voice center. We welcome you to visit us at our convenient Davis Highway location in Pensacola. At the Reesburg Institute, we offer the most advanced treatment available in a calm, stress-free environment. Since 2014, we've performed over 1,000 cases in office of balloon sinus surgery, as well as septoplasty and nasal procedures using oral sedation. The in-office procedures result in a faster healing time. Visit us and feel the difference.
Animal Allies is looking for volunteers, and there are many ways that you can help. From taking care of cats to using your computer and social media skills, any and all assistance is greatly appreciated. We have morning and afternoon shifts every day or help at adoption events. You can even foster a kitty at home. And it counts towards community service hours for bright futures. Find Animal Allies Florida on Facebook and Instagram, or go to aaflorida.org/volunteer.
When cancer tries to take you away from the things that matter most, Baptist Cancer Institute offers caring physicians and the most innovative treatment options. With convenient locations and a wide array of support programs and services, we're here to help you during the most difficult of times. As a member of the Mayo Clinic Care Network, we're bringing even more innovative cancer care to our community right here at home. When you need cancer care, we'll be there.
you want to see for the City of Pensacola in the next decade? City leadership has begun the strategic planning process for a 10-year vision for the city. The initiative is called Strive to Thrive, Pensacola 2035, and the city has partnered with Gehl, a renowned urban design and strategy firm, to help craft the process. We have Anna Muessig with Gehl and Adrianne Walker with City of Pensacola here to tell us more. Thank you both for being here today to talk about this.
Thank you for having us. Thank you.
So can you give us a brief overview of the process for building this 10-year strategic plan?
Sure. Well, Gehl partnered with the city and some community groups to think about how should we be planning for the future of the city. So, we are a firm that's based actually in Copenhagen, New York, and San Francisco, and we work all over the world, all over the country, in small, medium, and large cities. So we took all of that knowledge and brought it to Pensacola to really understand what's happening in the city today and where it can go over the next 10 years. We started with a process of really reviewing all of the many plans that are shaping the city today. So we read the waterfront plan, the housing plan, active transportation plan, so many different efforts and initiatives that are fantastic in the city. What we found was missing is one sort of strategic overview of how to really prioritize different efforts. So we spent a couple of months on that. Then we came to the city and did our first vision group. And this was a group of community leaders that represent all segments of the community here. So elected officials, community leaders, sort of the grass tops of folks who are leading, civic services, and major employers, nonprofits, things like that, to really understand, what their priorities are. And at that time, we opened up a survey. So the survey went live in mid-April. It's open all the way through the end of July, and we're really hoping to hear from a broad swath of Pensacolians who we really want to hear from. So we have many different ways of listening to what people really want, and we're going to integrate that into the strategic plan.
Awesome. So let's talk more about those public input surveys. How can people take the survey, and what is the timeline on that? I know you said end of July.
So the survey is open now. It's at Pensacola2035.com. We are looking for citizen input from all different types of community members, not just city residents, which we have had some feedback, people asking, well, can I take it? I live in Escambia County or even Santa Rosa County. This is open to anyone, because anyone who's visiting Pensacola or coming to Powell Fox Street, they have a voice to be heard. So that survey is live right now. It'll go through the end of July, so July 31st. We have about 4.5 weeks left, so we're really going to start pushing with more digital promotion, trying to capture these voices. We also have paper copy surveys for anyone who isn't online. We do have those distributed at some of the major places like community centers, the local libraries. So we're trying to think of those members who also aren't kind of so much digital, so we have a variety of opportunities.
Well, I love that you have the paper surveys, because that is part of the population we serve. Some of our older adults are more comfortable doing things with pen and paper. So when people are thinking about taking this survey, how should they approach it? Like, what should they be thinking about as they respond? Because I was looking at it, there's some little like essay questions. You could put a lot of thought into this.
Yeah, and we'll be reading all of them. There are 3 main things that the survey asks about. The first one is, what do you love about Pensacola? Like, what brought you here? What's keeping you here? And what do we need to know to continue to build on to make Pensacola even stronger? The second thing we're asking about is, what are some of your concerns? What do you feel needs fixing, needs attention, needs investment? We need to hear that too. There's many efforts in the city of, investing in different parts of the city. Is the city on the right track, or should we be prioritizing something else? And then the third one, which is really fun, and we hope that people can dream big, is we're asking people, what is their dream for Pensacola in 2035? What's their big idea? That could be a big idea related to mobility, around community centers, around job creation and innovation, all sectors of what city government does, which is really a lot. We're asking people to dream big and share their big idea with us.
So let's talk about the interactive map. That's a part of it. I went in there and saw that there's an interactive map. Can you tell us a little bit about that and what people should be using that for?
Yeah, we hope that people use that. And if you're not online, you can fill it in on your pen and paper. It's another way for us to really spatialize how people feel about Pensacola. So Gehl is a firm that really thinks about our experience together in space. So, there's lots of essay questions, and we want to hear that too, but ultimately a good life comes down to the experiences that we have with each other. And those experiences happen in a place. They happen walking along the waterfront, they happen in our backyard, they happen at like a nice patio on Palafox Street. And so we really care about where your favorite places are. And so we're asking that question, where is your favorite place in Pensacola? We can learn a lot about that, not just where is it, but what are the qualities of that space? Already, a lot of people have said that downtown is one of their favorite places. One of the things that is telling us is that there's a lot of things that are going right in downtown, and that was not by accident. Creating a great downtown happened over decades of investment of many, many people over time, making that a great place. So how can we think about bringing that same type of care and attention to other places around Pensacola? So the other question we're asking in the online map is, where do you think needs attention? Now we know some of the questions on there people have answered, like that corner really needs a street tree that's taken down, or there's a pothole over here, and that's great. We'll get it to the right people for sure. We're also asking about, to people that dream big. What is their big idea? Do they want to think about a re-envisioned port? Do they want to think about what the Baptist hospital should be, or Cordova Mall, or a certain street? So we're looking for those specific big ideas that can be, spatialized in space. But we thank everybody for filling it out.
And I think we were talking about beforehand, some of these things you can report on 311 if it's one of these smaller things that can be fixed. And this is a place where you can, dream a little bigger, have a big idea that you could put into place. So along with public input, just briefly, what are the other components that will come together to make this strategic plan?
Yeah, so we've heard a lot from community groups. We're going to have a couple of focus groups, especially with folks who may not be coming out for the open house or don't have time to pay attention to a survey, like young people. We're going to have a focus group with young people to hopefully focus them and have them share their experience of Pensacola with us. And the survey is going to be a really big tool for us to really hear from people. And Adrianne has some other ideas too.
Yeah, and just to add to that, aside from the survey, like she said, if somebody doesn't want to take the survey or, busy, we understand. We do have opportunities to engage nonetheless. We have a specific email address. It's strategicplan@citypensacola.com. We're happy to take any input. We'll take it in email format, which we have received some in that way. We also have a dedicated phone line. It's 850-435-1671. If somebody's not online and doesn't, even want to swing by, they can call and leave a message. We can return it, talk through their feedback. So we're trying to make sure we have ample opportunity for people to engage as we round out this engagement period at the end of July.
Gotcha. So a lot of opportunities to get that feedback. Well, thank you both for sharing about this.
Thank you for having us.
Thank you.
Next up, we're discussing United Way of West Florida and their century of community service. Stay with us.
I don't know why you're so sad. You've got a roof over your head.
Bro, you gotta stop with that depression stuff. That's a white people thing.
Escúchame, en esta casa los hombres no lloran.
You alright?
It just feels like it's coming from everywhere.
Do you want to talk about it?
Thanks for hearing me out, bro. Appreciate it.
You can talk to me if you're feeling sad. Whenever you need to talk, I'm here, okay?
¿Qué color? Perfecto, mijo. Gracias. Thank you. What's wrong, mijo?
Donating to a pet's medical care is one of the many ways you can help families in your community. Pets and people belong together. Learn more at petsandpeopletogether.org.
United Way of West Florida is a well-known organization dedicated to uniting nonprofits, businesses, and individuals to fight for health, education, and financial stability for every person in Escambia and Santa Rosa counties. This year marks a major milestone for the organization, 100 years of dedicated service. Here to talk to us more about United Way's programs and initiatives is Executive Director Laura Gilliam. Thank you for joining me, Laura.
Thanks for having me.
So, first of all, tell us a bit about the mission of United Way and how you carry that out.
So the mission of United Way is to unite our community by leveraging resources to improve lives. So we do that by making transformational investments. That's probably how people know us the best. That's what we've been doing the longest, through grants, by building capacity, not just our own to serve the community, but also of nonprofits in our area, because we know the stronger the nonprofit sector, the stronger the community. And by connecting people to resources. And we do that through our helpline 211-988, the Veteran Support Line, as well as our free income tax preparation service called VITA.
Gotcha. Well, I know United Way is celebrating their 100 years this year. So what has been going on and what will be going on to mark this milestone?
Yeah, so we started in 1924 by Agnes Weiss, who was kind of a visionary. She and a group of people decided that we needed to support, or the community needed to support, nonprofits, and so we've celebrated all year long. We've had some proclamations by local government. We were in Tallahassee with 3 other United Ways in the state that are also celebrating 100 years. We had a Glitz and Gallop Gala in May on Kentucky Derby Day. We've had different events and activities, tabling events in the community. We have our Centennial Club. We have Give 100. Which is either, if you want to make a financial contribution of $100, 100 pennies, or 100% of your time. What can you do to give back to the community?
I like that. So at Council on Aging, we are often, when people call us looking for resources, very often we also tell them, in addition to whatever resources we have, we tell them to call 211. So for those that don't know, and hopefully most people do know, what exactly is offered with 211?
So 211 is a free information resource and referral line that's available 24/7. So if you call at 2 o'clock in the afternoon or at 2 o'clock in the morning, you're going to talk to one of our team members. And we, most often when people call, the top 3 reasons they call are for help with food, rent, or mortgage, and utilities. That person who answers the phone is going to get some information from them, some basic demographic information. It can be confidential. They don't have to give them their name, but they'll need their zip code. They'll need some information. Is there a person with a disability? Is there a veteran in the home? Because that's going to determine the type of service that might be able to help them. And then based on all of that information, they'll connect them to the resources that will most likely meet their needs.
So you're kind of filtering for that eligibility and where is going to be the place that gives to the veterans or the people with disabilities.
Exactly. It just is more efficient. It means that the person doesn't have to call 5 or 6 different places. They can call 211 first and increase the likelihood of receiving assistance.
Absolutely. And it's frustrating to call someone and be told, call this number, call that number, and you're just going down. It can be, make someone want to give up, basically.
Exactly.
So do you have any current or upcoming programs or events that might be of special interest to our older adults in our community?
Yes, so we have the Retired Senior Volunteer Program, which is for people who are 55 and over. And on July 23rd, we have a lunch and learn at the USO on NAS. And so that'll be a nice opportunity to learn more about what the USO does and maybe look at some volunteer options there. On August the 8th, there's going to be a Snacking with the Seniors Lunch and Learn, and there's going to be some conversation about disaster preparedness and mental and physical health.
Awesome. Those are great resources. And what else do you have coming up?
Well, we have Stuff the Bus on July 25th. That's the school district supply drive for Escambia and Santa Rosa County. That's at the 3 of the Walmarts in Escambia County, 3 in Santa Rosa County. Opportunities to give to make sure that children have the tools they need to succeed or to volunteer for those as well.
Excellent. So what are some of the ways people can get involved in United Way?
So obviously they can make a financial contribution, but they can also give their time. We have lots of volunteer opportunities that are in the office, participate in Day of Caring, which is coming up on October the 18th. We have an ambassador program. They can become a community investment volunteer, which is part of our grants process. But we also have a platform on the volunteer tab on our website, which is UWWF.org, and that will actually take you to a list of agencies in the community that have volunteer opportunities available. So not just things that we have that people can connect to, but we offer that as a service to the community so that people can get engaged with other nonprofits.
Awesome. So you're kind of the one-stop shop for all things nonprofit. Tell me a little bit more about the kind of partnership organizations, the grants that you give out to the local nonprofits, because of course we're a United Way partner organization ourselves at Council on Aging.
Yes. So every year we kind of start this process again, and we are directing the dollars to agencies that are working in the areas of health, education, and financial stability. They fill out an application, talk about the program, give us a budget, what are the outcomes going to be, and that process itself is volunteer driven. I mentioned just a minute ago community investment volunteers, so those are people in the community who review and make recommendations for funding to our board, and our board of course is a volunteer group as well. So it's a pretty robust process, and we're really proud of it, and directing dollars to those programs that are going to make the greatest impact in the community.
Absolutely. I know we are always crossing our T's and dotting our I's with our grant process for United Way.
Yes.
Well, it was so wonderful to have you, and I would be remiss if I didn't say you're my classmate for Leadership Pensacola, class of 2024, so awesome to see you again.
The greatest class ever.
The greatest class ever. Thank you.
Thanks.
And thank you for watching. Until next time, enjoy life. You've earned it. From Meals on Wheels and respite care to senior dining sites and the retreat, you'll find the support and connection that you need to age well. Aging looks different for everyone, and we're here to help you meet your needs and thrive while maintaining what makes you, you. We've been in the community since 1972, advocating for elders and supporting those who care for our parents and grandparents. Now, join us as we discuss the age-related issues that matter to you.